Tavengwa. I'm a community engagement and development worker for BHA for Equality. I'm going to be doing a Q&A with Jeff Ukiri, who works with men at George House Trust, men living with HIV. He offers them support and he runs a group with the men who are living with HIV. So today we're going to do a quick Q&A. Jeff, can you tell us what do you do and about yourself, just a mini biography?
Well, my name is Jeff. I work with an organization called George House Trust, and I work to support African men living with HIV by providing a safe space for them to come together to have interactions and share experiences of living with HIV. Okay. And I also have one-to-one support with these men to explore their situations and provide appropriate interventions.
Okay, that's interesting. So how is it like working with the men? Was it easy to set up the group, and how is the attendance?
Well, like every other project, it's not something that is quite easy at the start. Mm-hmm. But what we've done was to identify the needs that were prevalent among these men and looking at how to address the needs. So we developed cultural appropriate approach to providing support, and looking at identifying activities that were pertinent to men's need and helping those activities to address the needs of these men. So what we did was to come together to really look at these kind of activities that these men will be enticed to, and then put those activities together and get these men to attend this event.
Wow, wonderful. So how is the promotion going for men who don't know about you? What ways do you use to promote this service? Because some people could be new in Manchester. How can you let people know about this service?
Well, if you're living with HIV and you live in Greater Manchester, well, George House Trust is there for you to contact. We have a number, 0161274499, 0161274499, or you can email me at jeff@ght.org.uk, jeff@ght.org.uk. And one of the things we try to do in terms of promotion is to engage with community groups and community outlets out there, GPs and doctors, clinicians, HIV doctors, to increase referrals, to ensure that these individuals or these doctors refer individuals to us. These are the ways that will increase our engagement numbers.
Okay. Oh, that's interesting. I'm going to put the details at the bottom of this video anyway, so you find George House Trust and Jeff details on that video. My next question, so what can you say about relationships for Black Africans living here in the diaspora in terms of sexual health? As you know, that the way we're raised as Africans, it was more like taboo to talk about sex. So what can you say now in relationships for people who are living in the diaspora?
I think relationship should be seen as two people coming together to share companionship. I think we don't look at relationship from that aspect, because most of our relationships are only predicated around sex. But as we get older, you find out that sex plays very minimal role in relationship. Okay. There are a lot of men who develop erectile dysfunction at some point in their lives and they can't engage in sex. So are you going to say because a man cannot have sex, then you can walk away from relationship? I think relationship goes beyond sex. But also, we have to also understand that sex is just like you wanting food. It's our body's, our body yearns for sex, just like our body yearns for water, our body yearns for food. And it's a craving that should be normalized. Okay. I think we shy away from that discussion because we think it is secretive, because it engages the activity and it engages the activity of someone else. But the truth is that, sex is something that you value, but also something that you want to give. But you also want to give it to somebody you care about, somebody you love. So you don't want to just open yourself to anybody. Yeah. But also you have to understand that there has to be a balance, because a lot of times we attach so much importance to sex that we lose the fact that sex is a way that the body yearns for it's a natural thing. So if we look at it from those perspectives, to understand that our body yearns for it, but if you want to engage in it with someone you think is worthy of engaging it with.
Wow, that's amazing. Some great points there from Jeff. But what can we do to improve communication about sexual health and testing in relationships? As you know, that work in sexual health and getting tested is very important, and we want to promote that. So, but I know that in our community, sometimes this communication about sex is quite complicated. So, what can you say to improve communication? So, it's just adding on to what you said about relationships.
But the thing is, sexual health is very important. As long as you engage in any kind of sexual practice, it is important that you look at your sexual health. You know, if you're eating, you don't just eat. You have to watch what you eat and also make sure that you go for exercise so you stay healthy. The same way, if you engage in sex anyhow without watching it, then you'll be susceptible to acquiring infections. So as much as you engage in anything that is beneficial to your body, there has to be precautionary measures that needs to be taken to ensure that you have the best of it. So for example, if you eat and you eat in excess or you eat anything that can harm your body. So the same way, if you're having sex, it is important that you just don't have sex anyhow, but have sex with somebody you think is safe. And how are you able to establish that the person is safe? Is by undertaking screening. And these screening methods are there for you to ensure that the person you're having sex with is the only person you're having sex with, and the person is safe for you to have sex.
And they're able to communicate together about
yes,
it,
and there are screening programs out there that can enable you to screen yourself. Most of the screening programs are free. You don't have to pay for them. There's utilization of condom. There's also screening that you can access from local communities such as BHA and even sexual health clinics. Those are free and you can access them just to know that you are in a safe place and your partner is a safe place. This is very important. You see, African communities, we run away from the discussion around sex, but we engage in sex a lot. So why don't you want to discuss something that you engage in so much? I think we should take away the taboo that is attributed to sex discussions and normalize the discussion so that I can be open to it. Because when you're open to discussing something, you are free. You can easily walk into a chemist and say, I need a condom. You can easily walk into a sexual health practice and say, I need screening. You can easily have interactions with your kids or your brothers about the importance of safe sex. It is important. Safe sex is not only about having sex with just one person. It's about knowing yourself. It's knowing yourself. Knowing yourself that listen, I am in a very good state sexually, and I regularly screen myself, and I'm safe, and I have nothing to transmit to somebody else. And also ensuring that person that you're having sex with also is free of that. Because what I would like to know, there's long-term implication if you are not aware of your sexual of your health status in terms of sex. If you're not aware of your HIV status, or you're not aware of your other STIs, so if you're not aware of them, this can have long-term implications on your health. So it's important that you know much about it so you can prevent long-term complications.
Wow, amazing. I think all heard what Jeff said. And the other thing that women always tell me, they say it's very hard to communicate with our partners. Men sort of like close up on this subject. So what can we do to encourage men not to shut off when it comes to this subject? Because sometimes women tell that they tend to push them away when they start raising this subject because they are afraid of blame. So what can we do about men to encourage men not to shut off?
I think you need to understand that most relations that thrive are relationships that are very compatible sexually. When you have those kind of discussions and free discussions around sex, you have banters around sex, it makes your sex far more enjoyable than coming through through an approach that is very conventional. Men love sex and women love sex as well. So if you're having sex with somebody, why can't you discuss it? You can discuss food. You can discuss food. You can discuss water. You can discuss drink. Then why can't you discuss something that you engage in on a constant basis? It is important that you open up and discuss about sex. For example, if you notice something maybe a particular smell is coming up from the vagina of your woman, instead of just grumbling or telling your friends about it, have a discussion with her. Go to your GP and talk about it. You see, it will enhance your sex better, because at the end of the day, you can say, oh, or I'm not enjoying sex because there's bacterial vaginosis. My girlfriend has contacted bacterial vaginosis, and you don't want to discuss that. Who does it impact at the end of the day? You. You understand? Why don't you have that discussion so your girlfriend can go to the doctor or your wife can go to the doctor and discuss it, you know, and treat it. You know, you have to understand that some of these sexually transmitted infections that we come across are not something that people just go and take on themselves. For example, if you know that sexual transmission is somewhere, for example, if you know somebody is having a particular sexual transmitted disease, you would not just go and have sex with them. Most times, inadvertently, it comes on us without being aware of it. So it's not something we go and take on ourselves, and we should not blame ourselves for acquiring infections. That's why the clinics are there to treat us, because the clinics have been brought in place to deal with to cater for such situations. So you go to the clinic and get treated rather than having a pity party or finding someone to blame.
Exactly. Yeah. Wow, amazing points there. You know, it says something very important, that if we are more open to each other as a couple, life will be so much easier. If I'm able to talk about PV with my boyfriend, bacterial vaginosis, and if I'm able to talk about contraception, then why can't we go and test together? This will help improve, our health, rather than shutting off and thinking to go away. So some great points there, Jeff. So another thing, that's the only way that the stigma can go away. So another point is, do you think that the way we're raised, our parents, most of them, Black African parents, used to avoid discussing sex, but do you think our generation, if we talk to our kids about sex, do you think it will help improve things when they get older, so that when they learn at home, they won't be afraid to talk to their partners about it? Do you think it starts with us as parents?
Yes, I think it is important for parents to discuss with their children, because a lot of times these children, if they don't have anywhere to have that discussion, they will go to their peers, they will go to their friends in school, or they will, or their friends in the neighborhood, and they would engage in activities that might lead to far more complication for their health than even any other thing. Because most of the times when you don't have that discussion, they will go and have sex with somebody and then they get infected. And when they get infected, they won't even be able to know what the infection is about. For example, you see, exactly. For example, you see a sore on your penis, and you think, oh, it's just a sore that's going to go away, but you may not realize that it's syphilis. So before you know it, it's germinating and growing and growing and growing, and then before you know it, you're hiding from your parents, and then suddenly you're walking somehow, and then your parents calls you to find out what is wrong with you. That's when they will realize that you have a big sore on your penis, and they rush you to the hospital. Sometimes this thing can have long-term effect if you're not. So it's important that as you look after your kids, you send them to school. You provide for them, you provide shelter for them, you clothe them. You also look at other aspects of their health. If they are sick, you discuss it. If they have malaria or any kind of flu or anything, you discuss it with them. So why can't you discuss sexual health? Because there are complications if caution is not taken in relation to engaging in sex.
Yes. And as parents, we bring them to life. We are supposed to guide them in every subject, rather than them just taking everything from outside. So, it's been an amazing discussion. Is there anything you'd like to add before we finish off?
Well, I would like to say that always screen yourself. If you're engaging in sex, always go and discuss. Always go to a clinician and get yourself screened. And discuss sex with your partner, and if you notice anything, go to the clinic. If you're having sex on a constant basis, periodic tests are important, and you can screen for everything.
Wow, amazing. Thank you so much, Jeff Ukiri. It's been nice doing the Q&A with you. We'll put his details at the bottom and the organization, so if you've got any questions, just contact us. Thank you so much for listening. Bye.
Bye.
Thank you so much, Jeff.
Let's see how it goes.